My name's Chris Theokli. I'm a consultant ear, nose and throat head and neck surgeon here at the Ashford Hospital. I see a variety of patients who come to see me for ear, nose and throat complaints, and more often than not we need to examine into the nasal cavity and down into the throat. The reason for this is because patients with nasal obstruction, for example, or patients who complain of a sensation of something in their throat need really close examination and to rule out any worrying problems that might be occurring. Conditions we often find in the nasal passageway include nasal polyps or evidence of sinusitis, and when we look down the throat we can often diagnose low-grade infection, inflammation or problems with the voice box. So most people who have this done say it doesn't hurt. It's a very fine camera that gets inserted into your nose and passes down to your throat. It often brings a little tear to your eye and people say it's a little bit uncomfortable, but on the whole it's really well tolerated. And the procedure itself doesn't normally last more than about 60 seconds, so it's nice and quick as well. The procedure is performed in the outpatient setting as part of your clinical outpatient consultation. A lot of patients tolerate the procedure without requiring any local anaesthetic at all, and no preparation is required prior to coming to your appointment. You do not need to starve yourself and you don't need to take any medication prior to having the procedure. We will now see a demonstration of nasendoscopy in practice. So this is the flexible nasal endoscopic camera, where you're going to use it on our patient Kim, who has kindly agreed to allow us to film her having the procedure done, and then afterwards we'll be able to see on the screen exactly what our findings are. So Kim, the camera is going to go in your nose, down to your throat. As it passes in your nose, you might feel it tickle, it might bring a little tear to your eye, but it'll be very quick and I'll be able to show you everything on the camera afterwards. Okay, so Lucy, let's clean the tip. Marvellous. And a bit of lubrication. So Kim, what I'd like you to do is just to lower your mask below your nose, but keep it over your mouth, please. Okay. Thank you very much. And we're just going to insert it gently in your nose. And we're going in your nose now. You're doing really well. Just keep breathing gently through your nose. You're doing so well. And we're in your throat now. So can you give me a nice E? E. That's fantastic. And puff your cheeks out. And relax. And can you pop your tongue gently out? And I've got a great view of your throat. And put it back in. And that's all done. And I'm coming gently out now. Perfect. That's excellent. If you have any concerns about what we've discussed today, please contact your GP or contact the Ashford Hospital directly.